Okay, so here is a question about a woman with hyperthyroid goiter and there is diagnosis with iodine deficiency. What will be the answer? There is improper diet can lead to this condition. Patient during RTA sustained sacral injury present with overflow incontinence where lesion can be. There is lesion in parasympathetic. Now, explanation is injury above sacral segment damage sympathetic nervous system and injury at the sacral segment damage parasympathetic nervous system. And the next one is the patient is having bleeding problem. PT is 14 second, APTT is 60. Bleeding time is 6 minutes and which pathway will be affected? It is intrinsic pathway and bleeding time PTT. For nutritional assessment, what assessment will we do? We will assess the patient's albumin and total binding capacity. Next one is muscle of forced expiration are internal intercostal and rectus abdominis muscle are the forced expiration muscle is performed by internal intercostal muscle with rectus abdominis. Next one is a Christmas disease. There is increased bleeding. What will be raised in Christmas disease? There will be APTT will be raised in Christmas disease. In Christmas disease, increased bleeding with raised in APTT level will be there. Now, here is the Now here you can see Christmas disease. There is skin bruising, nose bleed, urinary tract bleed, gastrointestinal tract bleed. So this bleeding can result into multiple features like Christmas disease is for also hemophilia B, and it is because of 8 deficiency. Hemophilia A occurs because of factor uh, 8 deficiency in Christmas disease. Hemophilia B is factor 9 deficiency. So factor 9 deficiency is there. It is male X-linked recessive with hemoarthrosis, bleeding in the joint, and tar-like stool, easy bruising, cola and coffee will be there. Colored urine is there as a clinical features. It is also known as hemophilia B, Christmas disease, factor 9 deficiency, hemophilia. Now the next one is Christmas disease, also known as hemophilia B, and there is extremely rare genetic pathological disorder in which there is a bleeding in the joint, inability of clotting that results into the bleeding, hemophilia B, factor 8 deficiency. Okay, next one is paraneoplastic syndrome occurs which of the following, which is small cell carcinoma of the lung. Paraneoplastic syndrome is the syndrome in which adjacent structure of the lungs are involved. On ECG of the girl, you see sort of the appearance. Atrial flutter is the classical presentation of the sort of the appearance. P wave and a ratio of P wave in the ratio is 3 to ratio 1. Pulse is regular, irregular atrial flutters, sort of the appearance. And next one is a surgeon performing thyroidectomy, upper lobe of the thyroid, which nerve is involved in the upper lobe that is external recurrent external laryngeal nerve. Okay, so damage in the upper lobe, damage will be external laryngeal nerve, while cutting lower lobe can damage recurrent laryngeal nerve. Superior thyroid artery related to external, while inferior thyroid artery related to recurrent. Superior laryngeal artery is related to internal laryngeal nerve as well. So these are some of the very important points that you should memorize. And the next one is a woman with history of trauma to head and neck region, having lesion on the tongue, protrusion tongue deviate to the left side. There will be nerve involved, which is left hypoglossal nerve. A patient suddenly developed no oliguria even after 3 dialysis sessions, failed to have urine output. Creatinine is 9.5. Biopsy shows cortical necrosis, severe acute tubular necrosis. What is diagnosis for the patient? It is irreversible injury. A 55-year-old male patient past history of epigastric pain which is taking antacid diagnosed with gastric lymphoma. What is most likely diagnosis? H. pylori can cause gastric lymphoma.